In Lecture C, we're going to pick up, we mentioned earlier in the previous section about there were things that help the venous blood get back up even though gravity's pulling at it, even though it does have the valves to help it back up to the right side of the heart. So, mechanisms of venous return. The first thing we mentioned were the venous valves, so more predominant in the lower extremities, especially the lower portions of the legs. And we said they're designed just like the valves in the heart to prevent backward flow of blood. So we know that the smooth muscle that are in the walls of the veins can contract under sympathetic nervous system innervation, and that of course would increase the rate of venous return by allowing the valves again to function more effectively. The other thing that is a huge contributor to venous return are things known as the skeletal muscle pumps. So as the vessels run through these big muscle groups, especially in the lower leg, as the muscles themselves are going to contract and relax, they're going to squeeze the deeper veins and propel the blood up out of the lower limbs. They literally squeeze the blood into the veins and then propel it up against gravity back to the right side of the heart. So as skeletal muscles contract and relax, they act like a pumping system to propel the blood against the gravity. The respiratory pump is another effective pump. So notice as the blood now is in the abdominal cavity and also the veins of the thoracic cavity, you have these rhythmic changes in pressure between the thoracic cage and the abdominopelvic cavity when we're breathing. So during ventilation, these changes are going to rhythmically occur with pressures above the diaphragm versus below the diaphragm. So during inspiration, you're going to have higher pressure, of course, in the abdominopelvic cavity. This causes a pressure gradient that propels the blood into abdominal veins upward toward the heart. The lower pressures in the thoracic cavity allows those veins then to expand within the thoracic cage, and again the blood to be accepted higher above the diaphragm. During expiration, the abdominal veins are going to expand, fill with blood, and then the thoracic veins are squeezed as the muscles of the thoracic cage come back in and the pressure change within the thoracic cage for expiration. So with the respiratory pump and the skeletal muscle pump working together, that's why it makes sense physiologically for us to get up and exercise. People that sit behind a computer or sit for long periods of time allows the blood to pool up, and a lot of times they will have the beginnings of varicose veins, and they'll also have some circulatory problems unless they get up and move every so often. So we know that the body, again, using the capillaries and these vessels, it can shift the blood flow to the needs of the body. So the arterioles shift the blood flow with the different priorities that the body's under. So if you eat a high carb meal and you sit down in the recliner, notice he already has a built-in table there with his abdomen, and he's watching a football game on a Sunday afternoon, you're going to have reduced flow to the legs because all the blood is going to the mesenteric artery, feeding the mesentery around the intestines because he's digesting that large carbohydrate meal. But if you got it from the table, went in the backyard, played basketball, or kicked the soccer ball with your kids, or did some type of exercise, of course your skeletal muscles are moving, the thoracic pump is moving, so the arterioles would increase blood flow to the legs. So again, it can be diverted to different areas. Notice that would constrict the blood flow to the intestines and the mesenteric artery because the blood is being diverted to the lower extremities. As far as maintenance of blood pressure, again, a lot of times your patients that have a monitor on them, it will give you the map or the mean arterial pressure. So it's usually around 95 millimeters of mercury, and any deviation from this will trigger different mechanisms within the nervous system, the endocrine system, and the urinary system to restore blood pressure back to that level. So either high or low mean arterial pressures. So notice short term what can happen. We know the nervous system and hormones can begin to work to maintain mean arterial pressure. These are usually by adjusting resistance out in the vessels, and again, the nervous system innervating to the smooth muscle in the walls of your vessels can influence the vasoconstriction or vasodilation, and then also we know hormones can affect cardiac output. Long-term control is more mediated by the urinary system and other hormones of the endocrine system. So these effects would be in the arteries, achieved by either increasing or decreasing the water volume that's lost in the urine versus the water volume that's in the plasma. So both of those would affect blood volume, and especially we know that aldosterone, antidiuretic hormone, diuretics, all of those would influence for either increase or decrease in water loss in the urine. So short-term control, we said usually the nervous system and the endocrine system, neural control. We've already talked a little bit about neural control with the baroreceptors for pressure, the chemoreceptors for the chemicals. Long-term effects, though, it's usually the endocrine system and then the urinary system. So as far as neural control, again, it is a negative feedback loop that exists. So anytime there's an increase in blood pressure, the mechanoreceptors that are within the carotid artery and the aorta, which are considered to be baroreceptors, would respond to. The feedback loop, as far as chemicals, would result in either vasoconstriction and a rise in blood pressure because the chemoreceptors detected, again, changes with pH, levels of oxygen, levels of carbon dioxide. So the peripheral chemoreceptors, those that are out in the body, are going to regulate our breathing, and that will also affect blood pressure by how much oxygen levels are in the blood. Your central chemoreceptors, those that are up in the aortic arch and the common carotid artery, those chemoreceptors are usually responding to decreases in pH, and especially on the fluid that's feeding into the brain. So that would trigger another feedback loop that would indirectly increase the sympathetic neurons that are involved, vasoconstriction would happen, and you would have a rise in blood pressure. So again, blood pressure regulated by both the baroreceptors and the chemoreflexes under the neural control. So long-term, we said by influencing the amount of water, either retention or decreased retention, that can affect blood volume and directly affect blood pressure. Capillaries. Now moving on to capillaries, again we said these are the business end of the circulatory system. They're there to allow the tissues and the cells that make up the tissues to be delivered with their metabolic needs. So it supplies the metabolic needs to those tissues and organs. Without capillary beds, there are some tissues that we know that are avascular, especially epithelial tissues. Remember, they were avascular, like in the skin. Cartilage, remember, cartilage was avascular. It was the connective tissue that was avascular. The sclera, which is the white part of the eye, and the cornea. You'd literally see rose-colored everything if you had blood vessels in the cornea. So those areas lack capillaries. We know again that the blood that's coming to a tissue through a capillary bed is known as perfusion or tissue perfusion. The amount of blood flow through a capillary bed into a tissue or an organ. As far as their structure and eventually their function, we know again that they're extremely thin, a simple layer of endothelial cells that are only about 2 micrometers thick, 0.2 micrometers thick. We know again that they're simple with just a lining of endothelium rolled into a tube, and they do have a basal lamina for support that the endothelial cells will secrete. So the picture shows you a generalized capillary. Notice though on the picture there were some little extensions around the capillary wall, and these are known as periocytes. So these are cells that are associated with some capillaries. They have contractile filaments within them. They appear to control the blood flow in that capillary, so they help regulate the blood flow into that capillary. Usually the wall itself, only 1 to 3 endothelial cells. You have tight junctions that literally bind the capillary together through the whole circumference. So again, you don't have leakage of every portion of the blood, but it will be designed for diffusion, osmosis, and filtration. So if we look at the 3 types of capillaries, we know that they're going to vary by their different functions and also their different structures. So there's slight variations between the 3. So we'll analyze the continuous capillaries, the fenestrated capillaries, and the sinusoidal capillaries, or the sinusoids. So your textbook gives you a nice little chart to look at the diagram, to analyze the structure, figure out where it's most predominant in the body, and then of course its function. So in the notes we know that a majority of the capillaries are continuous capillaries. These are the ones that are found in your muscles, especially skeletal muscles, your skin, most of the nervous system, and most of your connective tissues. So these capillaries are the least leaky, meaning that they are the ones that permit the fewest substances from leaving the blood supply or from the lumen of the capillary and get it out into the extracellular fluid or the interstitial fluid. So fewer substances can enter and exit the blood using what we call the paracellular route, and that's because those cells that are the endothelial cells, we said one layer of those are bound by tight junctions. So they're the least leaky, but these are the majority. The most of the capillaries that are found in the body are continuous. So if you notice, you see the tiny little intercellular clefts. So tiny particles and solutes could leave through the intercellular clefts, but because of tight junctions that bind most of the cells together, those are going to make them the least leaky. So if you recognize the cleft versus the size of a red blood cell, these are minute little spaces that are there. The fenestrated capillaries are the ones with pores or holes in them. So these are much leakier than the continuous because they actually have larger pores or fenestrations. This is going to allow then the diffusion to take place at a very quick rate, and also when compared to continuous capillaries, it's much more quick. We find fenestrated capillaries where things need to enter and exit the blood from the capillaries and from the interstitial fluid back and forth, like the kidney. So the kidney tubules usually are going to have fenestrated capillaries. So we see this under the electron microscope where the fenestrations look like little holes or pores. So if you notice the side that's toward the actual extracellular fluid, interstitial fluid, you have all these fenestrations that are there. You do have some intercellular clefts, but those endothelial cells again allow tiny things to diffuse right through the wall of the capillary. The final one are the leakiest of all because they consist of these large cavernosus areas that are known as sinusoids. So the sinusoidal capillaries are the ones that have this discontinuous sheet of endothelium. They have very, very large pores, these huge cavity open spaces, typically 3 to 4 times larger or bigger in diameter than the other types of capillaries. They're going to have irregular shapes because their boundaries are going to be determined by the organ that they are found in. So we find sinusoids in organs like the liver, where blood clotting factors, proteins that are generated in the liver have to get into the blood, or they leave the blood into the liver. Same thing happens in the spleen, your lymphatic organs, and also your bone marrow. So all of your new cells with hemopoiesis then come out of the bone marrow, and they'll eventually enter into circulation once they're mature. So we know that the sinusoids will facilitate transfer of these much more larger substances like large blood cells, like these large transport proteins, albumin. I've already mentioned the clotting factors, and that exchange can happen between the interstitial fluid and the blood. So again, the sinusoid in the liver, you have the hepatocytes, which are the liver cells, cuboidal cells with microvilli. They can secrete substances into the sinusoid area, or things can leave the blood and get into the tissue to be detoxified or to be taken care of. Notice you have hepatic macrophages. Remember, these are going to act like garbage disposal systems to clean up these solutes or these old cells that are old and worn out in the sinusoid. So in this section we talked about 3 mechanisms of venous return. The valves help out. From the head, gravity also works for venous return because gravity's pulling down. So anything in the head and the neck region, gravity helps out venous return. But in your lower extremities, we said you need the valves and you need the nervous systems to help regulate vasomotion to propel the blood, the venous blood, against the gravity that's pulling down on it. We also said that by exercising, the skeletal muscle pumps squeeze the blood as those deep veins then run through these muscle groups in the lower extremities, propels it up toward the abdomen. Then we said with the respiratory pump, by breathing, respiring, inhale and exhaling, you can allow pressure changes between the abdominopelvic area and the thoracic area so that, again, blood is propelled toward the right side of the heart. We defined mean arterial pressure, and we talked about short-term and long-term regulation for it. So with the endocrine hormones, we're involved with both. The nervous system with short, the urinary system with long-term regulation. And then how does neural control regulate blood pressure? We said that with baroreceptors and chemoreceptors, it can influence in either an increase or a decrease in the blood pressure. Which hormones would raise blood pressure? And then which hormones would lower blood pressure. I believe that was given to you in the chart, but we know that things that would raise blood pressure would be aldosterone, an antidiuretic hormone, because we're holding on to the water. Diuretics should lower blood pressure because you're getting rid of the volume of water in the vessel. What are the structures and the functions of the 3 types of capillaries? Well, you had the continuous, which were the majority in the body. You had the fenestrations or the pores, the fenestrated capillaries, and then you had the large cavities, which were the sinusoids or the sinusoidal capillaries. And we told you what they function for and also their basic structure. So a fenestration, we said, is a pore or an opening, and a sinusoid is a much larger area, 2 to 3 times that of a fenestration, and definitely bigger than the intercellular clefts in continuous capillaries.